So the aim for today is to find out who Public Health Scotland is and what learning opportunities you can find on our virtual learning environment. So one of the main questions we get asked is, who is Public Health Scotland? Public Health Scotland is an NHS board and it was launched in April 2020, just at the beginning of the pandemic. However, we made the most of it. Public Health Scotland are also Scotland's lead national body for improving and protecting the health and well-being of all of Scotland's people. And this is mainly what underpins what Public Health Scotland does. What do we do? Well, our vision is working towards creating a Scotland where everybody thrives, and that is one of our main drivers here at Public Health Scotland. And our purpose is to continue to lead and support work across Scotland to prevent disease, prolong healthy life and promote health and well-being. So one of the things we get asked is, well, how do we achieve this? How do we work? Well, public health is everyone's business and we work in collaboration with others. Because as a society, what we do collectively can then assure the conditions in which people can be healthy. So we can't do this alone. And everything that we do with our partners is underpinned by our values. So Public Health Scotland, we always seek to engage everyone to play their part, and because we believe it's through the organised efforts of society that we can give everyone the best chance to live long, healthy and fulfilling lives. So what are the drivers really? Well, Public Health Scotland, what we really need to do is Scotland needs collective action to improve our healthy life expectancy and reduce health inequalities. Public health seeks to engage everyone to play their part. We focus on prevention and early intervention. We aim to increase healthy life expectancy and reduce premature mortality by responding to the wider determinants that impact on people's health and well-being. The wider determinants of health are a diverse range of social, economic and environmental factors which influence people's mental and physical health. So you'll see the diagram on the right there about what shapes our health. So 40% of what shapes our health are the social and economic factors such as where we were born, where we live, our education, what opportunities do we have to gain good employment, our housing, etc. So these make up our social and economic factors. 30% that shapes our health is our own health behaviours, and this includes our choices in relation to exercise, diet, drugs, taking drugs, alcohol, and 20% is made up with health services. And health services obviously is also about how accessible services are for everyone. So this is a main area that can really shape our health. And of course, our physical environment. So if you think about the low emission zones, the green space, it's all of these that really impact and shape our health and well-being in Scotland. So Public Health Scotland believe that it's through the organised efforts of everyone that we can give everybody the best chance to live long, healthy and fulfilling lives. Now going to look at our virtual learning environment. And to help to explain this even further, I've invited my colleague along, Michael Salko, to answer some questions on your behalf. Hi, Michael, how are you?
Hi, Moira. I'm well, thank you. Hope you're okay as well.
Yeah, I'll just let you introduce yourself, Michael, to everyone.
No problem. I'm a Learning and Development Manager at Public Health Scotland, and one of my main responsibilities is making sure that the virtual learning environment, our digital platform, is available at all times, and make sure that the content that goes on there is of high quality and supports people out there that are learners coming on and accessing the content.
That's great. Thank you, Michael. So first question, what is the virtual learning environment, and are you able to share your screen at all?
Yes, I can. So as I said, it's a digital learning platform that hosts a range of different learning resources. They could be learning hubs, shorter modules, blogs, podcasts, publications, articles, could be a variety of different types of digital learning. And also we sometimes do live online learning events. So the digital learning, the virtual learning environment is a space that hosts all of that
Right.
in one
Brilliant.
place.
So I suppose the first question is, how does someone access the virtual learning environment?
Well, when you go to the virtual learning environment, which is learning.publichealthscotland.scot, you can access the virtual learning environment by logging in or by creating an account. Up in the top right over here of the screen, you'll see a login button, which if you click it, it takes you to a page like this. If you've already got a login, you complete your details and you log in. If you don't, you need to go to create a new account. And when you go to create a new account, there's a couple of details that you need to complete, like choosing your username and password, putting in your email address, etc. And then you create your account over here. What happens next is you would get a confirmation email, but make sure that you check all mailboxes, including your junk, just to make sure that it didn't arrive there. And you want to confirm your account, and then you should have access.
Oh, that's great. So I take it, can you also access the platform without creating an account?
Yes, so I'm not logged in at the moment. And if, for example, I wanted to explore what's there and I looked at some learning hubs, I might land up on this Introduction to Public Health Learning Hub.
Good
And
choice.
here I can see an introductory animation telling me about this learning hub and what the hub objectives are, what the hub is aiming to achieve through this. And then there's an enrollment button. And because I'm just a guest, I can only get so far and I can only see this. But once I have logged in and I go to the same place and I enroll in that course, enroll me, then I should have access to all the material for that learning hub, which you can see here hosts 8 different parts to this learning hub, as well as, you know, further resources to explore and things like that, and all transcripts.
Is it just learning hubs, or are there individual pieces of learning as well then, Michael?
So this is an example of a learning hub, but we do have other shorter courses or modules, which are just single units that cover a particular topic that a learner can go through. Yeah, we do have a number of them as well, and a number of larger hubs. So it's a mix between them.
So great. So if I went into the learning hub, does the learner have to complete all of them? And do you get a certificate, or how does it work?
So the answer is no, you don't need to complete all of them if you don't want to. But in order to receive a certificate, you do have to complete all the required modules. So there are a number of different modules here that you need to complete to get your certificate. But if you simply wanted to cover just one area, for example, the role of the third sector, you could simply dip in and dip out of that section. It's entirely up to you as a learner how you would like to use the platform.
Good. That seems, yeah, that's quite flexible then in terms of learning and what you can choose to learn or not choose to learn. So who are the learning resources for, would you say then, Michael?
Well, it's a wide audience, I would say. Anyone out there working in either the public sector, the third sector, the private sector, local government, the NHS, educational sector, students, for example. Anyone out there where they want to know more about inequalities or public health issues and related topics, and how to make a difference in their service or the community that they're working within, for the people out there that they are supporting or providing a service for.
And what kind of benefits would the learner gain from these? Obviously, you've got the content's a benefit. Is there any other benefits in terms of how the resources can be used, or?
Well, I think the first thing is to become more knowledgeable about these different areas. So, for example, here about the Introduction to Public Health, understanding the role of the different sectors or organizations out there, and what part they can play is one thing. The second thing is it could be used in different ways. So, for example, if you were a manager, you might want to do a short information session or team session around one of these topic areas, or you wanted to gather views from your staff about around an inequalities problem or area of work. You could use the content in diverse ways. We have alternative formats available for all our content, so you can download all the content in Word documents or other alternative formats that will then enable you to go and remix it in a way that you feel is appropriate to be used. So you could use it in diverse ways, I would say, not just on the platform.
Are there any sort of restrictions on accessing our resources at all, Michael?
No, it's free to use, and it's free to create an account and log in. I would say the only restriction maybe is how much time you have. The more time you have available to spend browsing, looking at the resources, completing them, and then implementing that learning into your practice, the more benefit you will get from it, I would say. So I would say time is the main constraint, if anything. Other than that, there shouldn't be any further barriers for you as a learner.
So is the learning mainly, is it on health inequalities, the learning, the topics of the learning?
Yeah, anything that touches those areas, I would say, mainly around inequalities and public health. So it could be we have, for example, hubs around poverty. We have hubs around communication, making communication even better. Hubs around helping you implement some of your learning into practice to tackle inequalities and things you can do, how to engage with different communities, for example. There are lots of different topic areas that learners would find useful to understand about and then make a difference in their practice or in their roles.
Yeah, that's great. Thank you, Michael, because I know that we did have the challenging weight stigma learning hub, and I believe that was very popular in terms of people using it with their teams and members of staff, and it also had a collaboration space as well.
That's right. Again, a very similar hub to what we have here on screen with the introduction to public health. However, the Challenging Weight Stigma Hub, we did try to get learner-to-learner engagement by using different digital tools and online discussion boards. And we're thinking about having that concept a bit wider across the platform to get learners to engage with one another. It's in development at the moment, but yeah.
Oh, that's brilliant. And how is the learning content developed? I mean, how's the integrity of the learning content maintained? Is it true content? How's it developed in these resources?
So all content that's designed goes through quite a rigorous process. A project team would engage with many different stakeholders or organizations out there or academic experts in putting the content together. And it would also be quality assured and peer reviewed within our own processes to ensure it's accurate, it's up to date, it's of high quality, it's evidence-led before it actually makes it on the platform. And content that does make it on the platform going through that quality assurance process is checked every year, is maintained, is reviewed every couple of years. And we try to make sure that all the content is as accessible as possible to all learners.
Yeah, I can see that there's an accessibility sort of bar at the top there, Michael.
Yes,
And I suppose that's to ensure that all our resources are accessible to wider audiences and international audiences and national audiences as well. Would that be fair to say?
Yes, we have learners from all over the world. The majority are from the UK, but we do have learners that find their way to our platform from all over.
Great. Yes. So what would you say then in finishing then, the reasons why people should come on here? What would be the benefits to maybe the individual and the manager?
I think a learner that might come to the platform would be leaving with more knowledge about areas of inequalities and public health. which would ultimately put them in a better position to make a difference in their service or in their role within their work, whatever they might be doing. Most of the individual learners that might come to this platform would be engaging with either members of the public or communities or offering a service. So being equipped to understand the challenges that people might face out there will only enable you to provide a better service and improve people's health and well-being.
That's really good. Thank you so much, Michael. So in a nutshell, we've got a virtual learning environment with free, accessible learning resources for all, for staff, for the wider public, and anyone can access them. You just have to enroll to get full access, but it's available to everyone, and we will be sharing a link to it. So
Yes.
Thank you. Thank you so much, Michael, for your input. And as discussed, we have got links here, so please feel free to contact us as well on our workforce development email address. And also I've put up the links to the virtual learning environment and also to Public Health Scotland and our strategic plan as well, if you would require any more reading. So that's it from us, really. Thanks again to Michael, and thank you everyone for attending this session, and enjoy the rest of your day.